Hello everyone, welcome once again to Food Culture and More. I, Anamita, today will discuss a very common thing that is happening in this COVID situation, that is uprising cases of pre-diabetes and diabetes post the COVID recovery. So, what is the reason behind it? How it can be managed? And as usual, our motto more will be discussed henceforth in this video. So stay tuned and keep watching. Thank you. So what are the common ways by which you can easily find out that you are diabetic or pre-diabetic? Although pre-diabetes has no specific symptom as like diabetes, but still some of these symptoms can be common, like excessive fatigue, excessive hunger, excessive thirst, excessive urination, delayed wound healing, and drowsiness or feeling of too much of lethargic. So these common symptoms can help you to find out, but for a detailed checkup or analysis, I would recommend to obviously go for a blood checkup, which are three: can be random blood glucose, fasting blood glucose, and postprandial. And for a more exclusive blood test that is very much common, all the doctors and including dietitians also are prescribing that, HbA1c, glycosylated hemoglobin, which gives an estimate in better understanding of the blood sugar levels. So how to overcome it? For example, if you are having pre-diabetes or you are detected with diabetes only, how you can overcome from the nutritional point of view, to be precise. So first of all, you need to monitor, and you have to carefully channelize your carbohydrate sources, not stop it obviously. So you have to replace the refined carbs that you are taking in the diet primarily with complex carbs or fibers, like having brown rice or brown bread as replacement to the usual or the regular white rice or white bread. Adding a lot of whole cereals, whole vegetables, whole fruits instead of fruit juices in the refined format as much as possible, because anything refined or anything juice prone to increase the blood sugar level. But in this regard, I want to clarify, not the vegetable juices. Vegetable juices a diabetic can take. Then secondly, most importantly, protein sources. Being diabetic doesn't mean that you have to completely stop any protein sources or take go to like complete fasting, something like that. No, diabetic should be very carefully monitoring the protein sources, since insulin is a hormone and hormones are protein in nature. So when you are taking the in the medicine format, it is very important to keep the protein sources viable in the body. So you have to take a mix of veg, protein, and non-veg. For the non-vegetarians, vegetarians can include egg whites. If vegetarians purely they can include protein sources with a little bit of the roughage portion also, like sprouts, like chickpeas, like lentils. Especially the whole dals are beneficial. They can use black chana. They can even go for soya chunks. All these stuffs can be included. As like the milk products, milk products can be included. Low-fat milk products are supposed to be beneficial. If along with diabetes you have any other lifestyle problem like high cholesterol levels or uric acid levels, so it's important to have low-fat sources like curds are really beneficial for diabetic, that can be included. And thirdly, it will be very important to prevent fasting or skipping of the meals. It is at all not advisable for a diabetic to fast. Like after getting up, you have to take the breakfast without fail, like post taking the medicine, if you are diabetic. If not, for pre-diabetes also, it's very important to stop the fasting. Excepting on any emergency situation or unavoidable circumstances where fasting is a must, you should be refraining yourself from fasting, as fasting increases the spike in the blood sugar levels, so it is not at all advisable. Taking an early dinner, keeping a gap of 3 hours between your dinner and sleeping time is also advisable. Getting sound sleep for 7 to 8 hours is definitely advisable. Drinking 2 to 3 liters of water is also a must. And obviously refraining yourself from refined sugar or table sugar, if I can say, maida and its products, baked and confectionery items, added sugar beverages like cold coffee or cold drinks, sodas is also equally advisable. So these are the nutritional tips which you can put forward in your diet and definitely lead to a healthy lifestyle, although being pre-diabetes or diabetic. Even for the pre-diabetes people, you can reverse the situation also. So now discussing about our motto more. So what are the other things that you can put forward beside the diet and nutrition? So first of all, physical activity, because it has been seen to show great results in controlling the blood sugar levels with exercises regular, be it indoor, outdoor. So it is very important to inculcate exercises at least for 30 to 40 minutes if you are not having excessively high blood sugar levels that is promoting to any drowsiness or lethargy. Even in that case, at least 15 minutes should be done, and if not, then at least 30 minutes exercises can be done. If you have any physical immobilities or any other problems, then you have to take likewise things or likewise advice from your doctor. But apart from that, a normal individual having pre-diabetes or diabetic should go for regular physical activity. Secondly will be a routine blood checkup. That is a very important point to highlight here, that diabetes is a problem which can be controlled if not cured, and pre-diabetes can be reversed also. So for that, at least doctors sometimes suggest 3 months once for the HbA1c, and recent if some blood glucose level has gone up, like post COVID or due to some situations or being overweight something, so they ask to do a blood checkup after 1 month. Even dietitians also go for the same thing. So it is very important to do that checkup and not to ignore it at any cost. You have to do it, because even if you are diabetic, if you can't able to go back, but at least you can keep your blood sugar in control. That is very important, because uncontrolled blood sugar can lead to a multivarious health issues and it can be really hazardous. And thirdly, the most important point here is following all the restrictions that has been discussed all throughout the video. Diabetes doesn't mean that this is the end of the world or the end of your life. It can be controlled, and pre-diabetes, even if you are coming back from that situation to normal, you can again go back to that same situation. So to prevent it, you have to follow each and everything, all the restrictions and all the guidelines that has been mentioned. So be in control and lead a healthy life, even if being a diabetic or a pre-diabetic. So concluding this video today, as I always say, that stay happy, stay healthy, stay home and stay safe. Until we meet next time again, be home and be safe, and thank you so much for sparing your time and watching my video. Please do like, share, comment and subscribe, and let me know if you have any doubts or queries or any further question regarding this topic. Thank you so much.